Hello, everyone. Welcome to a special edition of AEC Today Reports. We have a special news bulletin and we have a very special guest joining to share some very important information with you. We're going to bring him on at this time, none other than our very own president. How are you doing, Elder Palmer?
I'm doing well, Sister Latasha. Thank you so much for giving us this opportunity and this platform to share with our conference.
Absolutely. So there's a lot that's been going on in our world. I know we're all processing what we're seeing in the news. And recently, Allegheny East Conference made the decision to return to virtual services, including also for our schools. Share with us a little bit about what the decision entails and how the administration came to this point.
Thank you so much, Sister Latasha. That's a good question. We recently met with our medical personnel who serve on our AEC medical team, and they shared with us some very dire warnings about what is coming. Not even what is, but what is coming. And for those of you who have been following in the news, you know that the number of cases reported has been, I think, over 400,000 for the last 3 days.
Mhm.
Each day, we are just, I mean, this thing is spiking out of control. But here's what was really frightening, Sister Latasha. The medical experts said, we're not even warning you about what is, we're warning you about what is coming.
Right.
They said that they expect over the next 2 to 4 weeks that things are going to spiral really out of control with this Omicron variant, and they wanted us to realize that we needed to get ahead of this wave that is coming. That we needed to make sure that we had prepared our congregations, our schools, our members as best we could for what is coming. In fact, the analogy that was used was that we are in the midst of a hurricane, and this hurricane is about to be upgraded from a hurricane 1 to a hurricane 5. They said the 5 is what is coming, and they wanted us to make all of the preparations necessary so that we could, like I said earlier, our members could be ready, our schools could be ready, our churches could be ready. So that's where we are. And I think you have a few things that you can share with us, some of the data that was shared with us.
Right.
Sister Latasha, you can share some of that data now so that folks can know some of the background as to what we actually was shared with us that made us say, you know what, it's time to return to virtual worship. So would you share that?
Sure. I just put on the screen here, and this is dating back to even last year when we were first introduced to the pandemic, where the World Health Organization, were advising the government that before they reopened, that the rates of positivity in COVID testing should remain at 5% or lower for at least 14 days. So that's the guidance I was giving then. And now, as we're looking at the rates, the current rates in the area, particularly in Allegheny East, of course, we focus on those areas. When we're looking at New Jersey, for instance, the positivity rate is 19.8. Pennsylvania
Wow.
follows at 16.3. Then Delaware at 11.1, Maryland at 16.3, Virginia at 17.2, DC, I believe, is going up, but 14.4, and then West Virginia 12.3. So as we're looking at those numbers, we see that that rate is, sometimes 3 or 4 times above that 5% recommendation. So it's pretty dire.
Yeah, and that's one of the things that really kind of said to us, listen, this is not the time to take chances. What we made, the decision that we made was, listen, let's go from now until about January 17, 18, somewhere around there, right after the Martin Luther King holiday. And as we're moving into that date, we will continue to evaluate, continue to look at positivity rates, look at hospital beds. We looked at hospital beds, how many are available, how many ICU beds are available. That data was shared with me independently. It is a frightening picture. But here's one of the things that I kind of lean on, and that's my father was a principal of a couple of our schools in
Mhm.
D.C. and Baltimore and also in Philly. And when snow was predicted, we would make preparations, but we would not close based on a prediction. What
Mm.
we would do is prepare. Now, once the snow started falling, we shut down quickly, right?
Right.
And so, in a similar fashion here, we're really just making preparation. It was frightening to think that a number of churches or a number of individuals might be not aware of just how dire things are right now and where things are uh, in we think projecting going to be. So the question then is, let's close now, but let's keep our eye on things. Maybe it doesn't get as bad as we think, because the truth of the matter is, if the predictions are right, we probably are going to continue this until February the 1st. But let's pray, let's
Yeah, it
hope,
goes.
let's desire that God would intervene somehow and that we could get back to in-person worship sooner rather
Right.
than later. But that's the reality. The reality is that if the predictions are correct, and we're looking, and we're not only just looking at this country, we're looking at what has happened where Omicron has gone across the world, and we're
Right.
looking at what has happened in Israel, what's happened in Europe, and when you look at the various places and you watch the trends, if this country follows the trends of other countries, we're going to have a really bad spike. Um,
Yeah.
at the end of this month.
And we're looking at the trends in behavior. I mean, these are the holiday, we've had
Absolutely.
Thanksgiving and then Christmas and then New Year's, and people who have been tired of hibernating are now coming out more and gathering more. So it kind of makes sense that the spikes are happening around this time of the year too. So that's something to be noted.
And you make such a great point. We're all tired. I'm tired of COVID. Okay. I am tired of COVID. I listen, there are days when I go to the grocery store, and you would think after almost 2 years in that mask would be an automatic, right? But I get out the car, I'm walking to the store, and then all of a sudden I realize got out the car without my mask, so I got to go back to the car and get my
Hmm.
mask. And even though I'm vaccinated, even though I'm boosted, here's the thing: I've taken the precautions, and a number of our members have. Let's be clear: a number of our members, a number of our employees, a number of our pastors. We have good rates in terms of those who have been vaccinated. But what the medical folks are telling us is you don't want to get COVID.
Right.
Even if you have a good outcome, even if you have a mild form of COVID, we still do not know the long-term effects of COVID 5 years from now, 10 years from now, because this is still a what they call a novel virus, meaning it
Hmm.
is relatively new.
Hmm.
So what do? How do you avoid getting COVID? You do the things that we've been told to do all along.
That's right.
Wear your mask, stay away, stay a safe distance away from people.
Hmm.
Um, Wash your hands frequently. Those things still work. They still
Hmm.
prevent COVID. Do as much as you can outdoors. If you're indoors, you need to wear a high quality mask. This is something that we didn't hear a year, 2 years ago,
Hmm.
wearing a high quality mask because
Right.
they didn't have enough for the medical personnel.
That's
But
right.
now that there's enough masks, get yourself an N95 or a KN95 and put, when you're in places where you don't know the people or you don't know their status, not their vaccination status, but their infection status.
Right.
If you haven't seen a PCR test and you don't know, and here's the crazy thing, and this is really sad, with all that we've done, even if you take a test, you can test negative today
Hmm.
and test
Next
positive
Monday.
tomorrow.
Hmm.
And here's what's so frightening. They're saying that you're most infectious 2 days before you experience symptoms and 2 to 3 days after you experience symptoms. So
Mm.
before most people are even saying, I need to take a test. I feel a little something
Mhm.
coming on. I feel
Very sick.
I'm not quite feeling myself. Let me go get the test. If they test positive at that point and they have symptoms, that means that 2 days prior they were infectious and they were at their highest level of infectiousness, if that's the right word. Is that a good word, Sister Latoya?
It works in
Infectiousness.
this context. We'll go
Okay,
with
all right, it works. This is the challenge that we face. This is what we're up against, and this is why we're saying to all of our constituents, our churches, our schools, even Pine Forge Academy, which has done an outstanding job during this pandemic. I mean, I listen, we are so proud of Pine Forge. Can I just put in a plug for Pine Forge?
Go
We're
right
so
ahead.
proud of Pine Forge because they've been able to give their students the closest thing to a normal high school experience of any place that I've seen or heard about. Now, maybe there are others who are doing a better job, but none that I know of. Pine Forge has done an outstanding job.
They have.
But with this Omicron, even they have had to make some changes in their protocols, and they are now, kids are going to have to stay on virtual learning a little bit longer because this Omicron is just different. In fact, Sister Latasha, can we just talk about this for a minute?
Sure.
How did they phrase it last night? This is almost a new virus.
Right. The level of intensity, it's, and people were saying, oh, it's not as strong as Delta in terms of its effects, but
Mhm.
it is highly transmissible. So, more people are spreading this, are able to spread it, and it multiplies. And that's what we're seeing in the numbers.
I mean, they're saying 5 times. Someone said to me, 5 times as transmissible.
Yeah, that's
That's
significant.
that that's significant.
Right.
And for our parents who may even be vaccinated, but have health conditions, we don't want to take the chance of them getting COVID. We don't want a school age child to bring COVID home. We don't want a church member to bring home COVID to a family member who didn't go to church but now gets infected and now has a negative outcome or a really severe outcome. That's what
Right.
we're trying to prevent against. So
Exactly. Yeah.
that's what we're up against, Sister Latasha. So
Yeah,
yeah.
safety is a priority, and that, I know every decision that our administration makes is based on that premise of making sure we're doing our part from a conference level to encourage as much safety as we can with our gatherings. Now, the one thing about this time around with going to virtual is that this is not new for us. We did it last year, and some of us are now kind of have a head start. So how is this transition to virtual a little different from what we did last year?
Yeah, and that's such a you're making such a it's an important question. Most of our churches that return to in person actually return to a hybrid service
That's right.
because the reality is the numbers that we've been getting from across the conference and from other conferences is that less than 50% of our members have returned even when we were in person. Most of our members, most of our constituents are still, or let's put it this way, at close to 50%, if not slightly over 50%, are still virtual,
Virtual. Hmm.
right? So this is really just a continuation of what they've been doing. We're just taking away the in-person component at this time until we get a handle on, is this thing going to be as bad as predicted? Because we don't want to get caught. This is one of those things where, so a snowstorm is predicted, right?
Hmm.
And you have the opportunity to run out and get some bread and milk and eggs before the storm comes, because you don't want to have to run out in the middle of the storm to
Right.
go and make preparations, go get the bread, the egg, and the milk, right? So this is similar here. We're saying, listen, the storm is predicted. It's going to be bad.
Hmm.
At least that's the prediction, that it's going to be bad. So you know what? Let's move to virtual. Now, if we find out that the storm is not as bad as we thought and we can go back to in person sooner, praise the Lord. Hallelujah.
Right.
We know that our members have been missing the opportunity to gather and to be with each other and to fellowship with one another. So yeah, great. But until then, until we know exactly what this storm is going to look like, we're going to hunker down and we're going to make preparations. So that's what I think is different. But there's one other major difference. Um, and this is where I really, our churches are ready. We've done Zoom, we've done StreamYard, we've done Microsoft. I mean, we have so many different platforms, and we are so much better prepared for those platforms than we were 2 years
Hmm.
ago when we first had to go virtual. That was we didn't have all of that. We've got so many more platforms, so that makes us so much more prepared.
Right.
It's annoying, you know.
Yeah.
It is annoying. A couple weeks ago, I was with a congregation, and I enjoyed being back in person. I want to be back in person, but here's part of what was different for us this time. Not only was the storm being predicted, but many of us had planned New Year's services for New Year's
Hmm.
Eve and for New Year's Day. There were communions planned, all kinds of things were being planned. And this is at a time when the last 3 days we've had over 400,000 people infected. I mean, no, tested positive, because
Yeah.
that's not the number of
Yeah. That's just what we
infections.
know.
That's just what
Yeah.
we know.
Right.
Exactly. Thank you. Great. Thank you, Sister Latasha. That's
Right.
what we know.
Right.
And we're saying 400,000 we know of for the last 3 days, and we're getting ready to go into a big holiday weekend. I know folks got their black eyed peas ready and they got their collard greens ready. Oh, okay, all right, never mind. Let's
Yeah, everyone's ready for those celebrations. And I think one of the things too that stood out from, we kind of mentioned it,
Mhm.
everyone's like, oh, are you vaccinated? People are using vaccination as, if you're vaccinated, you're safe.
Right.
And kind of debunking that myth and saying, I know you always say this, the safest person is not the one that's vaccinated, but the one that's been tested in terms of like,
Mhm.
your status, even though we know that's a little, that can fluctuate. But, and with knowing your status, that's very important for people to understand, because I know that there's some people have a hesitancy about getting tested even when they feel bad, but it's better to know and be able to take the necessary precautions than to continue
Absolutely.
this spread.
Absolutely.
Okay.
And if I could just add to that point, because I think this is really important, that's one of the things that also kind of drove our decision. We don't have enough testing in this country. I'm not
Mhm.
talking about in Allegheny East. I'm talking about in the country. It's not that easy to get a test. There are not, I mean, if you've tried to buy some of the home tests so
Right.
that you could gather for Thanksgiving or for Christmas, you know that how the shelves are bare when it comes to these home tests.
Mhm.
And these home tests are not as accurate as the PCR tests.
Right.
But even then, that's still a level of protection. But with the not having enough testing available, this really serious virus, which I think you just kind of alluded to, and really want to hit on the fact that people who are vaccinated are getting infected by Omicron. Now,
Mhm.
it is true that up until this point, we haven't seen as many bad outcomes as we did with Delta, um, but we are seeing many more people who are vaccinated now getting infected with
Mhm.
Omicron.
Yes. Yeah. And I know, a lot of that is, people feel that when they're vaccinated, they're kind of invincible now. And that's, you still need to follow those safety precautions that even the CDC and other agencies have put out there. And I just wanted for us to look at those. I know you mentioned some of them earlier.
Mm-hmm.
Of course, we're always encouraging those who have not, if it's your choice, the vaccine is available as well as the booster right now. Of course, continuing to wear your mask and make sure it's
Yes.
over your nose and mouth, particularly
Mm-hmm.
when you're in indoor public places, and avoid crowds,
Mm-hmm.
i.e., while we're moving virtual, and poorly ventilated indoor spaces. And then consider self-testing. And we talked about, they are available to you to go ahead and self-test before you go to these individual gatherings, whether it's family or friends. And of course, if you're sick or you feel a tinge of anything, please stay home. It's better to err
Absolutely.
on the side of caution. And lastly, over we underestimate the importance of washing our hands with soap and water. And of course, if water and soap are not available, please use hand sanitizer. So these are some of the things that we need to continue to do, vaccinated or not, to help us stay safe during this time.
Good reminders.
Yes, yes. So anything else important that we need to share with our members? I know, AEC, we're always proud of how our people are able to transition when it's time to make those shifts that we need to in order to keep everyone safe. Is there anything else you want our constituents to know during this time?
Well, first, before I give any last admonitions, let me just say this because it's on my mind. Thank you, Allegheny East constituents. Thank you, Allegheny East pastors. Thank you, Allegheny East employees. Thank you, Allegheny East educators, from the Office of Education down to all of our teachers, our support staff. Thank you for what you do day in and day out to keep our members, our children safe. Thank you.
Yes.
Um, that I, there are some things that I could talk about, in terms of some protocols, um, but but I really want to just say thank you, and thank you for each one of you who, whether you agree with our decision or not, will abide by this decision. Thank you, because you're saving lives. One of the things that we have seen from COVID is that COVID is no respecter of person.
Right.
COVID does not care if you keep the Sabbath. COVID does not care if you are spiritual. COVID will still take you out. Um, God has allowed some of our members to fall asleep as a result of COVID. So let's be wise. A word to the wise.
That's
Let's
right.
be wise. But I don't think there's anything else. But if you have any other
I
questions,
just wanted to, as we end, I wanted to recap for those who
okay,
may not have seen the notice and may not know what we're really talking
sure,
about. The fact that
absolutely,
effective immediately, all of our church services will be virtual, meaning we will not be gathering in the building. For those who had returned to in person worship, we will now transition back to virtual, at least for the next 2 weeks.
yeah,
Um, Also, with our schools, they will resume virtual learning on January the 4th. This is when they were supposed to return back to school. Now it will be online once again for 2 weeks, with the hope of returning back to in person on January the 18th. But of course, we're still monitoring the situation. Nothing is engraved in stone. And our office building, of course, will now be closed to the public. So those are the three main things that we wanted to make sure our constituents were aware of as administration continues to monitor the situation.
yeah. Thank you. Now, if this return to virtual causes some extreme hardship, there are ways to ask for an exception, but it has to be an extreme hardship, folks. Don't let's not just try to find an excuse to get around the rules. That doesn't help anybody. And even for those of you who are virtual but streaming from the church, if you even have a small crew coming in, please be wise. Test everybody that's coming in. Do not have folks in there that you don't know. And if antigen tests are okay if you're vaccinated and don't have symptoms, but still the gold standard is the PCR test. Get the PCR test where possible, because at least we have some idea that you're not going to infect others. It's not a guarantee, because we've seen that it's not a guarantee, but at least do that. So thank you, Sister Latasha.
Yes, thank you. Thank you. So, in spite of all that we've shared today, we do hope that everyone will have a happy new year, a
Absolutely.
safe new year, together with your family. And of course, I know you have a special New Year's message that will be shared as well. We hope you all will check that out. A special message from our president as we welcome in another year. Well, this has been AEC Today Report, special news bulletin, COVID update. Thank you, President Palmer, for sharing with us. We appreciate you.
Oh, Sister Latasha,
Yes.
as I say goodbye, can I just thank you for all that you do as our communications director? You keep our folks informed. You are so innovative with the Upset podcast and all of the other things that you guys do. Thank you so much for all of that. And we just appreciate you. And let me just shout out Sister Shauna K. Pottinger. She's
Yes.
behind the scenes. People don't always see her, but she keeps us informed. She's the one who pulls together our AEC Medical Advisory Committee. So we want to give her a shout out. We also want to give our HR Director, Sister Teresa Best, a shout out. You three ladies give us the kind of information that allows administration to make the proper decisions, or at least what we believe are the decisions that are in the best interest of our constituents. So thank you, Sister Latasha. Thank you,
My
Sister
pleasure.
Shauna. Thank you, Sister Teresa.
Thank you. Thank you. Appreciate that. All right, everyone. Thank you for tuning in, and we'll see you next time. Have a great one.
God bless.